pain, which number one is causing some abnormal biomechanics and is now causing you to protect that region and is why it's causing, some calf stiffness. I think you need to, look at it a little bit deeper, and that would be, obviously getting an X-ray, maybe even getting an MRI of the knee just to confirm that it really is an MCL. But usually MCL injuries get better, in 6 to 8 weeks. But certainly, if it is getting better and it's just some calf tightness, yeah, absolutely. I mean, I would work on some calf stretching. I work on some calf strengthening, and obviously, biking should not really bother this, so I think biking is a great alternative. Elliptical trainers, probably a reasonable thing to do, but yeah, I would continue to kind of work through this.
Yeah, MCL strains, it would be an unusual triathlon type of injury, but soreness on the inside part of the knee can be fairly common, and I think you have to make there has to be a determination whether it's overuse in biomechanical in nature or whether there was some traumatic episode that caused it. If it is biomechanical in nature, then you've got to take a look at what is happening down below, and we find that in individuals who have excessive it's called tibial torsion, where the lower part of the leg is rotating inward. It causes the foot to collapse more in a sort of a pronatory position. And if you've got that as a sort of underlying mechanical problem, that can cause some strain along the inside part of your knee.
Yeah, Joe, I think that's a great point. Again, just to reiterate what he said is that MCL injuries are usually due to trauma. It's usually an injury that causes it. If you're just feeling pain on the inner aspect of the knee and that's from running, it's usually not an MCL strain, and you really need to make the diagnosis and make sure, because there are some tendons that run around that region called the pes anserine tendons, but there's also your meniscus, that's inside of your knee that can be injured, as well as the joint surface too. So again, I think the take-home message is, if it's really not due to trauma, then I think you need to have someone take a peek and go a little bit further into making the diagnosis.
So we were asked if the New York City Triathlon is a wetsuit swim. Every year it's been a wetsuit swim since the inception of the New York City Triathlon 12 years ago. It's based on the water temperature, and if the Hudson River is over 78 degrees, we advise not to wear a wetsuit. So, but it hasn't happened, and we don't expect it to happen. So yes, it is a wetsuit swim.
I think the other point of that is also, if you're a first-timer in New York City, you will find when you get to the start line that although the start seems to go much faster this year, there's a very good chance that you're going to be standing in line on a hot day, and everybody's going to be in their wetsuits. I can only tell you that that is the first time period that will cause you to become dehydrated. You sweat incredibly inside of that wetsuit. So the advice would be is that kind of gauge the start and look at how you're moving forward, but do not fully put on that wetsuit, especially the upper portion, until you're within a corral or two from the start. You'll have plenty of time to get that swimsuit on. But I have seen people stand in line for upwards of 30 to 45 minutes sweltering in a wetsuit, and they're the first ones not to finish, or they're the first ones in the medical tent because they are so fluid depleted. So just really keep in mind that, and obviously have a water bottle with you. There will be garbage cans along the way that you can throw it away. And the good thing is that you can always pee in your wetsuit and no one will know it. You didn't hear that from me.
Another question. I have developed a very dark bruise on the back of my knee. I daily train for the New York City Tri, and during a 70-mile bike ride last weekend I fell, but did not notice the bruise then. Is there a treatment that you suggest?
I mean, the bruise can be, again, it's hard without having seen something. It often means that there was some type of internal injury and there was some associated bleeding. It could be just from blood that came from a deep muscle to maybe a little cyst in the back of the knee, what's often called a Baker cyst, that could have ruptured. Again, I mean, I think pain is the dictating factor. I would try to avoid things that seem to bother it. You could do some gentle massage that might help break up that so-called hematoma and move the bruising around a little bit. But obviously it's already now a few days afterwards, so ice is maybe a little ineffectual or ineffective. Maybe heat to that area, or have a physical therapist take a look at you. But I think, other than there being acute onset pain and really having a functional disability, I think you just kind of treat this with some tender loving care and back off a little bit.
One athlete asked, as I increase my training, I find that I am cramping more intensely and more often, even during the swim. Sometimes toe cramps occur when just walking during the day. In addition to the obvious sources of potassium, what can I incorporate into my diet and routine to combat these?
Again, I can try and answer that. A nutritionist would be the better of the people, but certainly, the potassium and sodium are the big things. Being, fluid depleted. Again, I'll come back to the point that I made early on. Make sure that when you're done with your workout, your weight is exactly the same as it was, when you started. I think flexibility issues are certainly, important when we start to talk about cramping. Cramping is from muscle irritability. Again, it's often due to electrolyte imbalance, but can just be due to overtraining. This is a situation in which the muscles are irritated, they're unhappy, and they're starting to cramp. So again, I think I would just look at your salt intake. It's often too, unless you have a history of high blood pressure or some other kidney abnormalities, it's hard to take in too much salt. That shouldn't be, dump the salt shaker on the food, but I think you might want to utilize a little bit more salt in the diet. But again, if you're only using water, as a fluid replacement, you might look to an electrolyte replacement. There's a lot of them that are out on the market. Again, it will be, to your palate of what you take, but I think, looking at the salt intake, looking at the hydration status, and working on some flexibility would be very helpful.
Yeah, it's very rare for feet to cramp, and the most common cause is really fatigue. And so the muscles in the foot are extremely small, and so if you're in the midst of doing a lot of training, foot cramps are a form of an overuse injury to the feet. And so one of the things that you can do with foot cramps is to do toe curling exercises or toe grasping exercises. Put a book on the floor and sort of curl your toes over the end of the book, and those will strengthen the small little intrinsic muscles of the foot and can help reduce your how often your feet cramp.
What are your opinions on alternative shoe styles, Newtons and Vibrams in particular?
Oh, let's open the can of worms now, or Pandora's box. I am not a huge fan. I'll let Joe answer also on this, but I'm not a huge fan as a sole running tool. I think that there's a place and time for everything. There are the Vibram 5 Fingers, to the Nike Freeze, to the standard motion control shoes, to a new variety of shoes that are out there called Hokas, which are the antithesis of the Vibram 5 Fingers, which have more cushion than Bozo the Clown shoes that I am actually running in right now. I think you have to be careful. I think I have seen lots of overuse injuries because people transition from one shoe to another all too quickly, and there's increased stresses and strains when you do something like that. So you have to be careful. I think the studies are really not out there 100%, whether or not running barefoot is really any better than running in a motion-controlled shoe. I think the absolute study that really needs to be done out there, which has not been done, is to take an individual or a group of individuals and place pressure transducers while they're living, obviously, in their spine, in their hips, and in their knees, and put on every different type of pair of shoe and let them run in those shoes as if they would normally run. I mean, it's clear cut when you run in Vibram 5 Fingers or Nike Freeze, your mechanics are different. If you're a 50-year-old person and decide that you want to go into those shoes, you're changing a lot of things, and that's a real setup, I think, for injuries. But until they can prove that study, where we show that there's decreased pressure in those joints, direct measures of that, I'm still not convinced that barefoot running is the correct way of doing it. So I think it's a good training tool. I think if you wanted to try to change some things and look at maybe more forefoot, midfoot